today I want to share what skills I think are necessary to be a successful social worker in the field after being in the field of social work for 2 years and in mental health specifically for almost 5 years. For those of you that don't know who I am, I'm Jackie. I'm a social worker. I graduated about 2 years ago, working on my licensure right now. And I like to share things that I've learned through my time working as a social worker to see if I could help anybody else wanting to get into the field or having any questions about it. One of the big ones is organization. I think that that's something that's a little bit overlooked because it's not so much of something that is like an emotional skill, but more so like you need to be able to know that you have your notes due this day, you have this many notes due, and like the notes can really pile on if you don't do them on time or you don't do them right away, and then you forget what happened in the session or you don't remember really the right scheme of what happened, and then it just gets more difficult as time goes on. Another one is having cultural humility, being culturally sensitive, right? That just means being able to, have a patient that you really aren't familiar with their culture or don't know a lot about, and being curious, asking questions, not assuming, not generalizing, right? Because that's when it becomes an issue. Not imposing any stereotypes, just making sure that you're allowing your patient to express their experience of their culture in your sessions, and then you using that as a way to kind of join with your patient. Another one is active listening, and this is not only with your ears but with your body. If you're listening to someone and you're like this, they're not going to think you're listening. But if you're listening and you're like focused on them, giving them eye contact, like nodding your head, making sure that you're making them feel, not only like so they can like think that you're listening, but making them feel that you're listening. That's what really like makes them hone in on, okay, this person really cares about what I'm saying. This person really wants to know and wants to understand. And I think that that's huge for a patient to feel from their therapist or their social worker. Another one is emotional intelligence. I feel like this one comes with time. You can have a certain level when you start becoming a therapist or social worker, but as time goes on, you'll learn different ways to use it, to perceive it, to manage it, kind of to control it in different aspects. And the last one I'll talk about in this video is advocating, because I think that one's really important too, because not only do you need to learn how to advocate for yourself as like a starting therapist or social worker, but advocating for your patients, especially when you're like starting up, because it's important if you feel like something is, beneficial to the treatment plan or to the way that you're working with the patient and others don't, if you're able to kind of back up your reasoning and advocate for that person like effectively, it will make a huge difference, right? So trust your gut, work as hard as you can to give the patient what you think they need, but also be open to criticism. Sometimes we're not always right, but don't allow people to just tell you no and be like, okay, fine, I'm done. But there's a lot more. Let me know if you guys want to hear some more. I have a long list that I've learned and I continue to learn.